Welcome to our show, Holding Ground. My name is Laura Richer. I'm a psychotherapist and the owner of Anchor Light Therapy Collective in Seattle, Washington. Each week, I'm joined by another therapist from the Anchor Light team to tackle important topics in mental health and psychotherapy. Our goal is to promote well-being by normalizing mental health challenges. We are here holding ground for you every Tuesday morning at 9:30 a.m. on KKNW. Good morning. You're listening to Holding Ground, the show that brings you a little bit of everything in the realm of psychotherapy and positive mental health. And today I am here with my original co-host, clinical director of Anchor Light Therapy Collective, Michelle Mooney. Good morning, Michelle. How are you?
Good morning, Laura. Good morning to our listeners. It's very exciting to be back with you. And, and at the same time, right, we have so many more skilled clinicians here, right, who are experts in all different areas. So it's great to sprinkle them in there and bring folks their perspective and their level of expertise. So you and I will still be doing these, but maybe more sporadically than originally. So, yeah.
Yes. Well, we are glad to have you and your expertise here today. So today we're going to be talking about a topic that I think is really relevant to what's going on in the world today. I don't know if you've noticed, but the world has kind of been on fire for the last 3 years.
Mm-hmm. Right.
Lots of stuff that we're reacting to right now. And being people who work in mental health, we're seeing how this impacts people. So COVID, of course, we're still dealing with that. Lots of negative news, lots of political events, like all kind of stuff is going on in the world that has been pretty upsetting to people.
Yeah. I mean, there's a war on the other side of the world going on right now. And watching and hearing about that, right? Obviously, a lot of gun violence that is just like increased so much. And I think I saw a statistic the other day, like since the beginning of the year, there's been like over 300 mass shootings, right? So we hear about some of them, so I mean, yes. So I think this is a good topic to discuss today. And you're right. It's kind of like pick your poison. There's a negative event going on. It seems like almost every day, and this is causing a lot of distress, right? More than just stress, but distress in clients. I don't know about you, Laura. I'm seeing, in my sessions, like this is coming up constantly, right? The state of the world and how it's impacting people, regardless of, what topic it is. And so, secondary trauma, right? So maybe we're not over in Ukraine, right? Maybe we're not in Europe that is having intense heat waves right now and burning down, but we're exposed to this information. And so secondary trauma, right, is repeatedly witness to it, right? Whether it's on the news, in person.
So, Michelle, I want to explain to our listeners a little bit about secondary trauma and have you explain what people might notice if they were experiencing that. Because, of course, we're upset when we see something on the news about school shootings or climate change. But sometimes there's one thing to see information and process it and see that it's negative and move through that. But sometimes people get stuck in it a little bit. So maybe tell our listeners a little bit more about what secondary trauma might look like for somebody.
Well, secondary trauma has pretty much the same exact symptoms as we can see with if a trauma were to directly happen to you. So a big one right now is hypervigilance, right? Kind of being on alert and almost expecting something else to go wrong is what I'm seeing with a lot of clients. And of course, right, we're humans too, and we have these experiences watching these things. So I'm kind of waiting for the next thing to happen. Other things like increased irritability, these things can deteriorate, our connections with others, how much we're showing up to work, nightmares, all of these things that we see with traditional PTSD as if it's happening directly to you. These things can also come out of secondary trauma, or other terms that we sometimes hear for it are secondhand PTSD, secondhand traumatic stress, secondary trauma, as we're saying, and then also compassion fatigue. So that comes out for a lot of people who are maybe in helping fields where there's this ongoing demand to be compassionate to people, and folks can get burnt out on that. So there's all these different ways that it can be presented or triggered by.
So how would that be different than a primary trauma? Are the symptoms really the same? Would you notice anything different, or it's just the fact that you have either witnessed that primary trauma has actually happened to you? Secondary is really more something that you've witnessed happening to someone else, correct?
Yeah, exactly. To someone else. So maybe it's not directly impacting your life, right? Maybe, all in all, you're doing okay. Thankfully, none of these things are directly impacting your life, but that they're going on, depending on how much you are exposed. One thing is people are sitting, watching the news, breaking news, right? They're constantly hearing about it. And, a secondary thing here is a lot, we're all going through it in some way or another. So there's this collective feeling of secondary trauma in a lot of ways. So, so maybe symptoms are a little bit more mild, but, really thinking even like secondary trauma can show up, outside of what we're talking about. So like, let's say you're growing up in a home where you witnessed your mom being abused, right? So that's not directly happening to you, but that's a very traumatic event. Right. And overall, what's happening, I think, with a lot of these things is what it's doing is it's really impacting and kind of degrading our sense of safety overall, right? And it comes down to safety in a lot of ways right now with all of these things that are going on.
Yeah. I've seen this with actually several different clients. Of course, the pandemic significantly impacted people in different ways, and they had a lot of responses to it. And then with the school shootings, I had a client a little while ago who could not stop crying about the school shooting in Texas and was very impacted by it. And also was confused a little bit because she said, I don't even know any of these people. I know that this is a sad thing that happened. And at the same time, I am so impacted by it that she missed work that day and really, couldn't move forward, which makes sense in a lot of ways. That was a hugely tragic event. But sometimes I think people can really have a stronger reaction than maybe they normally would, and it can surprise them. So what are some things that you can do if you notice that climate change or the things on the news or the pandemic or whatever are really starting to have some significant trauma effects and maybe impacting your day-to-day life?
Right. And it really is, right? These things are really impacting, I think, a lot of people's day-to-day lives. And again, I think a really big one is what's next, what's around the corner. But, one thing, like you're asking, what can folks do? Some people feel this sense of almost can feel like guilt around, well, do I deserve to take care of myself, right? Look at everything that's going on in the world. Some people can't take care of themselves. So, why do I deserve self-care right now? Well, we can't do anything, right? We can't be activists. We can't help out in any sort of way if we're not taking care of ourselves, right? So that whole concept of you can't pour from an empty cup. And so we're not able to be maybe as compassionate or responsive to things that we really want to be. And whether that's helping out with what's going on, if that's just interactions in your family and at work, right? You're distracted, right? You're not as your full self. So if we're not taking care of ourselves, we still need to do that.
And one way I've really noticed that people do this is that they will diminish their own experience. They'll say like, well, worse things are happening, and so I really shouldn't be depressed. And that isn't and just to let anyone off the hook who feels guilty about that isn't helpful. You not processing and acknowledging your own emotional experience doesn't change anything for anyone else. And in fact, just like you said, Michelle, it makes it harder for you to have capacity to be able to be there for other people.
Yeah. Losing the capacity to respond wisely to the world and what's going on. And you're talking about processing emotions. And I think that's really important because a lot of folks are just, I'm so stressed. Well, say more about that. What are your emotions? Is it sadness? Is it disappointment? Is it anger? And let's talk about that. Let's get it externalized so you are processing it, because, if we're not really talking about our emotions, it can be hard to attune to the emotions of others who might need support. Because we're not acknowledging our own, right? We might not want to acknowledge other people's because of that. Because like you're saying, kind of, people might not even know what their emotions are, right? With the one client that you were talking about. Yeah.
And find it confusing. And they might not even realize what it is that's impacting them, that maybe it is, here's another one. I don't know if you ever hear this from people. They feel a sense of almost guilt that they would pull back from taking in all of this information because it feels irresponsible to not be aware of what is happening in the world. So they're watching the news cycle, they're watching all the breaking news, they're getting all the data about the things that are happening, and it's not really helping anything.
No, it's not. And that's definitely one thing I talk to a lot of clients about is limit your intake of news. And so grab what you need, right? So if that means when you wake up in the morning, look at a couple headlines, because there is obviously relevant things that we want to know about, but then you don't have to engage in it all day long, right? It can be existing, but you don't have to reach out and grab it and look at it and interact with it. So there is definitely a balance, and we don't want to take our eyes off of things that are going on, but limiting how long our eyes are on it every single day, I think, is important. And that's social media, podcasts,
except for this one, you can listen to this one
and do it on repeat. And exactly.
Yeah. And, and that it, again, recognizing where you can be of service, where you can offer some sort of contribution and focusing your attention there. And that's great. But you taking in all of the negative information and just holding it, because there's some things that we can't do anything about. My power on this planet is limited, and I don't have a lot of influence on when we go to war or what's happening with the climate. And so while there are places that I can have influence, and I definitely put my attention there, I try to maybe block out some of the other stuff, just because there's, we only can hold so much.
Well, with direct PTSD and trauma, or if it's indirect, what's happening is our fight or flight is now engaged. And that's very toxic to the body if we're continuing in this state of acute stress. And toxic stress is a lot of what's going on right now. So if you're in fight or flight, your cortisol hormone, that's a stress hormone, way up, the adrenaline way up, right? And that's where the discomfort then in body comes from. And so if you're constantly in fight or flight, it over time, it does deteriorate your physical health as well. So that's another reason why limiting it and then taking care of ourselves, and specifically if we're in fight or flight, how do we self-soothe in those moments? What is soothing? And there's a lot of different things that work for a lot of different people. So what is the most soothing thing to you might be different from me, but obviously we also know, the traditional ones like deep breathing. Absolutely. There's a reason. It's not just take a deep breath. It really calms the nervous system. But other things like humming, singing, the vibration is soothing to our bodies. Putting something like a bitter candy in your mouth, you're shocking your system, become really cold. So if you can dunk and really this is a skill, dunking your face in like an ice cold water. If there's piles of snow outside, go roll around in it. Whatever it is to shock your system out of this fight or flight, is really important. And then you can hopefully more productively go about your day.
And I know with secondary trauma, especially if it's related to seeing world events and things like that, we do have the ability maybe to limit some of our exposure to some of those things. We might be able to take our attention off the news or not look at our social media. But there are other people who experience secondary trauma who are often in the healthcare field or emergency responders who they don't have that choice. It's their job to help support people in trauma. So what are some recommendations you have for those folks, or what are some specific challenges they might face?
Yeah, I mean, oh gosh, talking to some healthcare workers, nurses in particular are very much underpaid for the amount of work they're doing, the consistent exposure to not only COVID, but watching people suffer from COVID or other medical instances. Like if you're talking about EMS, right? They're picking up, and transporting all kinds of people who are under physical distress in some sort of way, and watching other people suffer constantly day in and day out is really difficult. And, healthcare workers signed up to, take care of people, right? And to be there. And so, but like I had one of my best friends, she became a nurse at the beginning of the pandemic. And it's kind of like,
oh, wow.
This isn't one exactly signed up for, right? I want to be able to help, but this is a lot. And so there's actually a statistic I read recently where, they did a study with some healthcare workers, and 88.2% of doctors and 79.2% of nurses were found to have some sort of secondary traumatic stress disorder at this point after going through COVID. And, those levels are high as well, even before the time of the pandemic, but especially right now. So again, the kind of coping strategies that I already suggested can also be beneficial as well. But, I'm seeing a lot of healthcare workers change their jobs, right? Or go from working in a hospital to a clinic, right? Where, they're doing 9 to 5 and they're doing dermatology and not emergency response and putting people in the ICU. So, I could go on and on about it, right? But we're not valuing our healthcare workers in a way that says, like that is compensating them for the amount of work that they're doing. So,
and besides maybe monetary compensation, what could we do to better support them? I mean, I think about what a difficult job being a nurse is. Not only do you need to be skilled in medical care, but you also, there's this expectation that you are empathetic and compassionate and nurturing and have a good bedside manner. And that's hard to do all those things in traumatic environments, in a pandemic environment, or, with patients who are a difficult population. I had a client a couple of years ago who was a nurse in a psychiatric hospital where there was danger. There was a threat of physical danger, harm. And it took a huge toll to where she wasn't able to sustain in that environment. And yet we really need people who work in those environments.
Right. And so, it's how do we show, and we, as a system, and we, in healthcare in general, how do we show value in a lot of different ways towards the folks that are doing this? And, what you're really getting at is burnout, right? There's only so much to give, and folks who are experiencing burnout can start to feel numb to being able to attune to their patients. They might be still doing what's necessary, but can they show up for their patients entirely, right? Emotionally and physically? Are they rushing or being hasty in certain tasks, right? Where maybe they were used to have more focus. Or having to take time off, and if that's not available to them right now. So people are really struggling in the healthcare field. So I think it's a systematic issue.
Well, that is definitely true. And for some of us that do work in healthcare, and of course you and I work as therapists, which requires focus and attention on other people. And I know for myself, I absolutely love the work I do, and I have to be mindful of how I take care of myself outside of work. So what would you recommend to people who are in a caregiving type of profession like we are, so that they can do the work that they love and want to do, to really support themselves and maybe prevent secondary trauma and burnout, and try to keep some balance? Not always possible, but what are some tips?
Engaging in things that you find meaning in or fun in. We all could use a little bit more fun and laughter right now to essentially distract. And and that we have to chop up the negative instances, right? They're going on, we're paying attention to it, we're showing up for work, but what can we do outside of the work to outside of our work time to refill that cup? It's connecting with others. That's so important, right? We're relational human beings, and focusing on our relationships right now, and what we continue to practice just gets stronger and stronger. So hopefully the self-care becomes more routine over time. But again, putting your feelings into words, getting outside is a really important one. Nature there's actually doctors now who prescribe going outside and going outside more, because we know the benefits of it. Building up self-rituals around self-care. And then limiting or paying attention to what we're paying attention to all the time. Right.
And what if somebody's really struggling? What if the symptoms have escalated to a point where they're not really able to self-soothe? What would you recommend?
Well, I think you know the answer to that question, right? You can come on in and visit a therapist and, enhance your skills of coping, because sometimes people don't know. And, the danger with healthcare workers or any of us right now who are struggling, we're seeing this a lot in teens who are in school and constantly afraid of a school shooting. They are engaging in maladaptive coping mechanisms. And, the number one that tends to be substance use, right? Because that's easy. You can go to CVS, pick up a thing of tequila, and you're not feeling that night. And if we're numbing, though, negative emotions, right, we're also numbing the positive ones as well. Yeah. So if you find yourself engaging in maladaptive coping behaviors, that's a good indicator that you're going to need a higher level of, connection with a therapist or a prescriber. Hopefully if you're taking medication, you're also doing talk therapy as well. But that's where we step into time where, seeking out resources beyond yourself and maybe your loved ones.
Getting some additional support. Yeah. And, as you point out, the substances can be very appealing because they're an immediate, you get an immediate relief from whatever you're struggling with. However, that tequila that you're soothing your anxiety with is going to make your anxiety 10 times worse the next day when you wake up. It's still there. It didn't go away. And so therapy, there's different types of therapies that you can do to help process stress and trauma that will be much more effective.
Yeah, exactly. Yeah, the anxiety that comes back the next day, right? You've suppressed your nervous system so much, and now the substance is gone, and now your nervous system is even more activated, right? So yeah, you're exactly right. And whatever we were trying to numb the night before is there the next morning and unprocessed and unresolved. So, and until we resolve these things and process them, they live inside of us emotionally and physically.
Going back to what we were talking a little bit about earlier, trying to diminish the response that you're having is also not going to be helpful. Sometimes people feel a lot of shame. They think I shouldn't be upset by this. I should be able to do what I've trained to do for my job or whatever it is. And the shoulds and the shame also are not going to support you. That's not going to help you process that feeling or just get over it.
Yeah, giving yourself compassion for where you're at and then nurturing the things that you might be absent and that you need. Asking yourself, what is your vulnerability and distress need? Is it therapy? Is it swimming? Is it a hug from your partner? Whatever it might be, take care of those things. And showing yourself compassion around where you're at, because you got there for some reason, right? And you might be working 110 hours a week in the ER. Well, that's how you got there. That's not normal. That's not what we should be doing. So of course you're going to maybe feel some of that compassion fatigue. And so shame, right? You're talking about shoulds. Shoulds directly translate to shame, right? I should have cleaned the house today. I should have shown up better for work, all of these things. And then the direct result is that sense of I'm bad in some sort of way, or I failed in some sort of way.
And what does trauma look like if it goes untreated?
One of the ways that it can directly affect us the most tends to be in our overall functioning, and it tends to be in overall functioning the most in our relationships. So if that's with our children, with our coworkers, with our partners, right? So you and I are couples therapists, and how often do you see trauma and trauma responses affecting relationships with others? So, and then again, physical health. If we're constantly under acute stress, we know it affects things like our blood pressure. We know it affects things like, heart health, brain health, blood pressure, physical fatigue and pain. So if we're constantly exposed to this, we're really, just thinking of, unfortunately, the word decay keeps coming to mind for me.
So lots of good reasons to, if you are struggling with any of these mental health issues, to just take a look at them. And there's lots of support. There's therapy. There's different things that you can do so you can process it and move through it, because it can really have a significant impact if it goes unaddressed.
Right. Yeah. Take care of yourself. Very basics. If nothing else, meet your basic needs. Eat, sleep.
Sleep could do wonders. That
yeah,
alone.
exactly. How different do you feel when you have 8 hours versus 2, right? Your body needs these things. You need rest. And that's a big important one too, is we need rest. And however you get your rest, obviously we want you to get your sleep. But if we're working back to back 12 hours, right? How can you rest differently? So yeah.
Yeah. And turn the news off sometimes if it feels like it's really triggering that fight or flight nervous system response. If you feel very agitated, it's time to take a break. And that's okay. No one's going to benefit from you getting into that escalated place.
Right. Exactly. Yep.
So. All right, Michelle. Well, thanks for joining me today. Lots of great tips on how to identify and what to do if you're experiencing secondary trauma. You can, of course, go to anchorlighttherapy.com and schedule a complimentary consultation with a therapist here, or use some of the tips that we discussed today. So thanks for joining us, and we'll see you next week. Thanks for tuning in to Holding Ground. You can hear us here every Tuesday morning at 9:30 a.m. on KCANW. I'm Laura Richer at Anchor Light Therapy Collective.
Find us online at anchorlighttherapy.com.
And we'll see you next week.